Hi, my name is Martin Portillo. I'm the President and Chief Medical Officer of Cone Health Medical Group. My leadership intent is to be creative, influential, and transformative. My HPL project is to innovate ways of increasing access to our patients, fulfilling the promise. Easy access, a solution for access and growth. We are here to take care of our patients and excel in service and quality. I know you are up for it, and we can do this keeping the provider experience in mind. We have a commitment, and the status quo will not allow us to get there. We stand on delivering prevention and wellness, and if access is not there, we will fall short. Our access metrics must meet the demands of our patients. So, the burning platform. How should we define success in primary care? Easy access is the first important step in helping define primary care. The enhancement of our healthcare teams is the next step. With the increasingly competitive healthcare climate, mergers, pricing, products, and service, we all need to understand that a successful delivery of care in the healthcare model is not what it looks like right now. We need a model that will allow us to address, with some flexibility, our needs into the future. So, the healthcare team is the core of the access transformation agenda. So, our shift to value-based care is imperative. For many years, population health and patient-centered medical home, the basic unit has been the team base. So healthcare team redesign is essential. This will lead to increased clinical support staff ratios, which are low relative to peers, allow current patients to access quality care within benchmark standards, and current patient demographics document an increase in volume of complex chronic conditions and comorbidities. When we looked at our current state, our primary care capacity was above the advisory board 10% standard. We were at 22%. 14% national survey will be 50,000 new visits or removing 12 FTE idle providers. Unfortunately, January 2020, COVID pandemic hit. Our face-to-face idea could not proceed. We had to reimagine a new healthcare delivery process. Hence, we developed and implemented a great telemedicine initiative. Hi, again, Martin Portillo. The learnings from the High Performing Leader program. Insights into my leadership strengths and weaknesses was one. This helped me understand my blind spots so that I can create the space to lead the transformational change. It taught me the importance of relationships, accountability, and integrity. It taught me to have a constant commitment to being complete with everyone involved. Doing so creates and sustains a clearing into which a new future can be created. We invent a future of possibility to which we commit our entire being. By listening, we align and create new conversations that establish a future with urgency, eager staff to execute with velocity. A new future that is compelling offers the opportunity to make a difference, individually and collectively. In doing so, new levels of results can be achieved, even new levels of fulfillment and self-worth for all involved. Thank you, HPL Consultants. As you can see, our entry scorecard, we track our patient satisfaction. We peaked at 92.0 mid-June and continue to stay high. We beat phase 1 volumes, and we ended phase 2 volumes at 84%, beating the 75% target. Our target in phase 3 is 90%, and currently we're at 87%, and we're tracking revenue and margin as part of that process also. And we're doing a lot of the work remotely during the crisis process. Results: satisfaction went up, visits 92% of pre-COVID volume, telemedicine 119,000 visits generated $11.9 million in revenue, CCM 1579 units generated $41,000. We learned that patients want convenient access. We collaborated with the lean management system, developed a pool plan, and now have 30% of our primary care practices deployed in healthcare team redesign. We also developed an A3 full virtual visits. Our target is 20%, stretch is 30%. We developed a tracker that drills down to primary care and specialties, and this information is provided to the practices so they support our strategy
in the new delivery
So,
model of care.
thank you for joining me. I hope we enrolled you. So we will track our metrics of success through patient satisfaction, with appointment availability, return phone calls, provider satisfaction, increased chronic care management revenue, and tracking our daily and weekly provider volume. All these will lead us to become a high-performing medical group. Thank you for following.